Myeloproliferative disorder (MPD) is a rare blood disorder caused by overproliferation of bone marrow stem cells, usually caused by Janus kinase 2 JAK2 mutation. This condition negatively affects quality of life of the patient. The blood cell production in the bone marrow becomes defective, resulting in the production of too many or too few blood cells. The principal objective is to learn how scientific research is working to improve the quality of life of patients with this condition while extending their life expectancies. The purpose of this research is to learn how patients live with this condition, how recently developed treatment options could help others, about current and past research papers done on this subject, and what can we expect to happen in the near future. Our body works through our genes. The genes are the blueprint that exists inside every cell of our body. The function is to tell our cells how to make proteins and enzymes. The enzymes and proteins relay messages to other parts of the body to perform other tasks, such as protecting our body from infection, help our body with digestion, or promoting cell growth. The JAK2 enzymes are responsible for creating new blood cells. While our cells grow and divide at the same time, our genes within the cell can get mutations. This mutation passes on to every cell it creates. When a gene gets a mutation, it can make the blueprint difficult to read and cannot create any protein. These are some conditions associated with MPD. The following content may be disturbing to some viewers. Viewer discretion is advised. Polycythemia vera is associated with the excessive production of normal red blood cells, white blood cells, and platelets. Essential thrombocythemia is characterized by increased platelets production alone. Primary myelofibrosis is associated with bone marrow fibrosis. Chronic myeloleukemia is characterized by marked increases in the number of white blood cells and sometimes platelets. Some of the symptoms regarding these conditions are fatigue, lethargy, excessive sweating, anorexia, bleeding, weight loss, abdominal fullness and pain, itching, cerebrocardiac or peripheral arterial thrombosis, pulmonary embolism, deep vein thrombosis of the leg, reddish skin coloration, and joint inflammation. Patients with these conditions can live for several years, thereby requiring long-term treatment and follow-ups. Others may live and die suffering some of these conditions, never knowing that they are inflicted by these terrible diseases. Two ways of identifying MPD, MPN, are bone marrow aspiration or blood and molecular test. To make a defined diagnosis, it is required that the patient undergo a bone marrow aspiration procedure. Through this procedure, it is possible to obtain a bone marrow sample which would be analyzed to determine if the patient has suffered JAK2 mutation or the mutation of other genomes associated with MPD, MPN. On Tuesday, March 30, 2021, I interviewed the patient Ms. Rey-Aponte, who was diagnosed with this condition since 2005. When asked about the diagnosis, she said it took her by surprise since none of her family members had a history of cancer. She started her medical treatment until August 2020, and her doctor informed her that she had fibrosis on her bone marrow and that it was just a matter of time before her illness would take the final toll. She was told that her spleen and liver would be the first organs to suffer. Her doctor informed her that he would prescribe medication to help her with the pain and fibromyalgia. Not happy with the news, Ms. Aponte researched medical facilities in the U.S. that could help her with her condition. She found a training hospital in St. Louis, Missouri, and she set her sights on that hospital. It was in November 2020 she was able to schedule an appointment and was seen by Dr. Stephen Ohm, a leading hematologist and MPD-MPN clinical researcher. To her surprise, Ms. Aponte was selected to participate in a trial study using new groundbreaking medication. She is now under medical care using that new trial medication, and her life has improved significantly. The medication used by the patient since November 2020 is only known by the trial name given by Constellation Pharmaceutical. The medication is known as CPI 0160. This medication works as a potent enzyme inhibitor that interferes with the production of malignant stem cells and or bad blood cells created by her body. This inhibitor allows her body to produce good blood cells close to normal levels. These are her before and after pictures. To sum it up, the photos shown speak volumes of the effectiveness of the medication Ms. Aponte is currently taking. We can witness here the miracle of life and the scientific advancements that we have made. Things that we should always keep in mind are to never give up when things are difficult and to always try and find a new solution. Thanks for watching.